Founded in 1875, Blessing Hospital was well known and respected as a quality community hospital meeting healthcare needs in Quincy, Illinois. In 2000, Blessing's leaders recognized that future success demanded the hospital expand its regional presence. Blessing activated its parent company, Blessing Corporate Services, or BCS, to guide the efforts that would transform Blessing from a community hospital to a regional health system with technology and services of the caliber of medical centers in Springfield and Peoria, Illinois, and St. Louis and Columbia, Missouri. Recognizing that physician admissions and orders for ancillary testing are drivers of hospital services, Blessing saw an opportunity to establish a physician network as a key component of the overall health system. Establishing primary care clinics in rural areas of the Blessing market was the first step to create a health system-based physician network. The clinics in Palmyra, Missouri and Hancock County, Illinois strengthened Blessing Hospital's physician referral base and opened the door for Blessing Corporate Services to enter the medical practice business. In 2004, BCS broke ground on a medical office building connected to Blessing Hospital that would provide space for outpatient hospital services as well as room for future medical practices affiliated with the Blessing Health System. As the year closed, several physicians with established Quincy practices approached Blessing about the possibility of an employment relationship.
I spent my whole medical career in Quincy, Illinois, and that's about close to 25 years. And I watched them practice of medicine evolve in Quincy. As I've also evolved my own practice, I've seen more and more restrictions placed on my practice through government restrictions, through insurance restrictions, mostly through paperwork. And now as the economy has evolved, there's more restrictions on a patient's ability to pay. And this has always become something that's been talked about and discussed a lot in my private practice, and it became a burden for me over time. And as Blessing Hospital became a regional center, and Blessing Hospital being a hospital that accepts all patients, I discussed with them the possibility of uniting or becoming a partner with Blessing Hospital so that I can get rid of some of these restrictions that I was feeling in the practice and dedicate, I return myself to more patient care.
BCS saw a tremendous opportunity to keep these quality physicians in the region and created a new affiliate of the growing Blessing Health System.
Well, Blessing Physician Services was originally formed to be a service organization for providers. The original intent was to be able to provide office space, staff, technology, to really meet and be a supportive organization for physicians coming into the community. The intent is to allow the physician to focus on their expertise and provide excellent patient care.
Physician recruitment of primary care providers and specialists intensified, and BPS more than doubled its size within the first 2 years. Several physicians who signed on were either natives of the region or had worked in the area previously. These doctors were eager to return to the quality of life the region offers.
As a woman in medicine, I have 2 small children now. It's very difficult for me to balance my work and my kids. Nobody else can be their mother, even though my husband's wonderful. So I was really looking for somewhere where I thought I could do that. So I wanted to feel like the organization really wanted to care for their patients, especially since I knew that if we came home, we'd probably stay for good. I really feel like here in Quincy, I can take care of my family and my patients.
BPS continues to attract these native sons and daughters, as well as other physicians seeking a balance between a rewarding profession in medicine and the ability to enjoy other passions in life.
My son plays soccer now in town, and I got time to make their games because everything's so close and convenient. And their time being young and growing up is such a short period that you want to take advantage of that.
To accommodate its incredible growth, BPS broke ground on a second medical office building in February 2008, doubling the size of its facility. Successful recruitment in a number of specialty areas allowed BPS to expand the reach of the physician practices by providing specialty services to the rural clinics within Blessing Health System and in collaboration with other medical practices in the region. BPS specialists visit area communities several times a month, allowing patients to conveniently access quality medical care closer to their own homes. Development of specialty clinics in rural areas and the growth of the Quincy-based practices have improved the patient's ability to access quality medical care enhance BPS's ability to maintain a culture that allows primary and specialty physicians to build referral relationships and better collaborate on patient care.
It's very collegial. You can discuss cases. People are not opposed to you kind of calling them up on the cuff and talking about cases. So I think it's a very nice, healthy environment professionally, and it's a good culture, and I think Blessing is continuing to foster that team approach.
As a part of the Blessing Health System, the primary focus of BPS is on building physician office practices. BPS supports ancillary services within the larger health system, referring its patients to Blessing Hospital for needed testing. This prevents costly duplication of services and allows BPS to support the mission of the Blessing Health System to provide high-quality health care accessible to all.
The approach to physicians always has been, how can we help you? How can we help you become a better doctor? How can we help you better take care of patients? Blessing is not held back in any way in how I can practice medicine, how I can deal with patients. In fact, as they encourage me to seek out new ways and seek out better ways of taking care of patients without putting any restrictions on me as far as who I can see and on what basis I can see people and what government regulations are, which is very rewarding.
At the heart of BPS is an intense focus on relationships and service. Patient visits and satisfaction scores have exceeded expectation. In satisfaction surveys, patients cite BPS providers as friendly, caring, skilled, and competent, said they would use the service again and would recommend BPS to family members and friends.
But in this setting, it seems that we actually get to provide the type of care that patients really appreciate. And you know, sometimes they wait a little longer because we talk more and we take the time to sit with the patients, but they understand because when it's their turn to be seen, they know that they're going to be heard and that they're going to get great care. Because we now have the time to provide the type of care that I think all doctors want to provide.
While hospitals take care of events in people's lives, physicians take care of people throughout their lives. They are at the heart of the healthcare system. The physician practice is the place where preventative medical care starts, complex medical care is coordinated, and trust is established between physicians and patients.
The philosophy that the BPS had and the philosophy that I have matches. Respecting the patient, taking the time to listen to the patient, and just providing overall good care for the patients that you see.
Blessing Physician Services is still an evolving organization. Blessing Physician Services remains focused on being the employer of choice for our staff, the partner of choice for our physicians, and the provider of choice for our patients.
I feel very supported. I feel great about the care that I give my patients, that my nursing staff, my office staff, they're wonderful. So I just think I've got the best of both now that I'm home.
At the end of the day, I think at least everybody, my colleagues here too in this suite, feel that they've done a good day's work and they've taken care of people to the quality that I think patients appreciate and we appreciate as doctors.